My name is Jonathan Bull. I'm a consultant neurosurgeon and complex spine surgeon working in an NHS practice in East London at Barts Health, based out of the Royal London Hospital, which is the biggest major trauma centre in Europe, and with a private practice in both East and West London, between the Cromwell Hospital and London Bridge Hospital, as well as London Independent, slightly further east and closer to my NHS practice. I think I wanted to become a surgeon probably slightly more than I wanted to become a doctor. I liked the idea, the combination of an intellectual challenge, so with almost like a detective type situation when you see a patient, take a history, examine them, and then put together the investigations and interpret the outcome, but with a practical solution. So a lot of surgeons enjoy the challenge that goes with going to theatre, particularly the challenge in operating on someone, especially someone who's well, and return them to that same well situation but in a better state. So I guess probably a degree of demand of stress and pressure, but with the positivity of a relatively short-term turnaround goal. So a positive outcome can be achieved with the satisfaction of a completed day of operating, or seeing a patient and actually enabling them to facilitate their own improvement and own recovery. So very boringly, it's going to come out as helping people, but I guess that's common to many professions. It's the detective type story. The patients present with interesting findings, interesting stories, and then trying to weave all that together in combination with the interesting imaging modalities, so CT, MRI, and all the developments that led on from there. I think that presented a challenge, and I was particularly interested in spinal surgery and nerves and how they functioned, and it'd always been interesting since being a child. That you get to experience sort of, I guess, pressure and stress in an environment where you can then improve and then see the results of your work in a again potentially quite short space of time, but also you get a lot of immediate feedback, so you've got a lot of responsibility, and if something goes wrong, you know who to blame and you know where to work on to improve. Hopefully they would, I mean, it's slightly presumptuous, hopefully they would value the time I'll take to explain and detail some procedure, and perhaps that I'm quite a conservative surgeon. I generally prefer to offer them non-operative options in the first instance, and that often less is more. And hopefully what I would take from them is that they will be happy to understand and explain their problems and open to discuss them, so we can best target the solution that's individual for them, because especially with spinal surgery, there are a lot of other factors that will play into problems with back pain, a lot of psychosocial factors, environmental factors, and often fixing those may well mean that you don't need a surgical solution, but that requires a degree of patience on my part, and hopefully at least some of the time I can show that. It is the complex background of some of the patients you deal with and the challenges that come with that, and trying to convey risk and also benefit, to explain, I suppose, in terms of managing people's expectations and understanding what outcomes can be achieved, and also empowering patients that they can realize their own goals by things they can do themselves independently. So, for example, engaging with physiotherapy, undertaking exercise independently, and managing their own goals through that, I think, is most helpful. And as the surgeon, you provide perhaps input in terms of a much bigger picture than just simply performing an operation. And there are many evolving different fields and opportunities, and with spinal surgery, you operate in multiple different body cavities from multiple different approaches, so it tends to remain interesting. And even at present, we're developing a new technique in terms of a minimally invasive or percutaneous technique for screws in the cervical spine, and a new challenge. So there's always something evolving which keeps you interested. Well, mainly it's that I don't operate to double standards, but it's that I would always try to do what I want to do for my own relatives or family or myself. Everyone will say the patient comes first. That's obviously true, but it's trying to offer a solution that's tailored to them, but will be something I'd happy for my own relative to have as well.